Have you ever wondered why sometimes a cough or a flare-up of your breathing difficulties clears up quickly, and other times it seems to linger despite trying different remedies? For those living with chronic obstructive pulmonary disease, or COPD, knowing when and how to treat an infection can feel like a real puzzle, especially with so much information available. To directly answer the question, yes, antibiotics are specifically designed to combat bacterial infections and are not effective against viral illnesses, which are a common cause of respiratory issues and COPD exacerbations. They work by either killing bacteria or stopping them from multiplying, helping your body to recover from a bacterial attack. The fundamental reason for this lies in the distinct biological makeup of bacteria and viruses. Bacteria are single-celled living organisms that can reproduce on their own and have specific structures, like cell walls, that antibiotics can target. Viruses, on the other hand, are much smaller and are not truly living organisms. Instead, they hijack your body's cells to reproduce, lacking the unique structures that antibiotics can attack. This means that taking antibiotics for a viral infection, such as the common cold or flu, will not help you recover and can actually contribute to a serious problem called antibiotic resistance. So, how can you know if an infection might be bacterial and warrant a discussion with your doctor about antibiotics? Pay close attention to your symptoms. While viral infections often present with clear, runny mucus and a persistent dry cough, bacterial infections might show signs like a fever that spikes, increased shortness of breath, changes in the color or thickness of your sputum, or a general feeling of being much sicker than usual. Keeping a symptom diary can be very helpful in tracking these changes. It is important to remember that COPD exacerbations, which are periods of worsening symptoms, are often triggered by infections. While many of these are viral, bacterial infections, sometimes involving common bacteria like Haemophilus influenzae or Streptococcus pneumoniae, do occur. Your healthcare provider will typically assess symptoms and sometimes order tests like sputum cultures to determine the exact cause of your infection. Using antibiotics only when necessary is crucial to prevent antibiotic resistance, which occurs when bacteria evolve and no longer respond to the medications designed to kill them, making future infections much harder to treat. Understanding that antibiotics are specific tools for bacterial infections empowers you to work more effectively with your doctor, ensuring you receive the right treatment at the right time. This knowledge helps protect your long-term health and the effectiveness of these vital medications, allowing you to manage your COPD more confidently.